All right, so we're back with Dr. Matthew Gaunt, Optimum DPT, Direct Care Physical Therapy Practice in Petoskey, and today we're talking about dry needling. So Matt, what's the difference in dry needling and acupuncture?
It's really a difference in treatment philosophy. When you say acupuncture, most people are thinking Oriental medicine, traditional Chinese medicine, and that is coming at a diagnosis and treatment through an Eastern lens. So they're looking at diagnosing energy flow issues and treating along meridians. And dry needling is more of a Western medical approach. We're treating the neuromuscular system and the musculoskeletal system. So that's primarily, oh, that cracked off very bad there.
All right.
That's the primary difference.
Okay.
I'll edit that one.
All right, so what's the basic premise? How does dry needling work?
Dry needling works through local effects and the central nervous system. So locally, you are, if you have a tense series of muscle fibers, a tender point or trigger point, the needle will come in and kind of deactivate it. You'll get a little spinal reflex called a local twitch response, and it'll calm down. And when that muscle kind of twitches and releases, that allows inflammatory chemicals to kind of flow away, which then allow the nerves in the area to desensitize and stop projecting pain or sending the danger signal up to the brain. Also locally, you get immune system response. So you get a stretch on the collagen fibers in the area, and fibroblasts will get stretched, and collagen fibers will help get realigned. The nervous system responds by causing an endogenous opioid dump, so your natural painkillers get released. You also have some interesting effects with serotonin and norepinephrine, also helpful for pain. And then finally, it affects the limbic system, which is your kind of seat of fear and stress, and it calms that down. So those are, in a nutshell, kind of the three mechanisms.
So you're talking about sticking needles in somebody. Does that hurt? Is there any safety issues with it?
I would say in general it is painless, all the way up to like a mosquito sting. So there's a little bit of discomfort with it, and some post-needling soreness is expected and considered typical. Usually doesn't last very long. Safety-wise, it's very safe. There's almost no risk of infection. Probably the most dangerous adverse event that happens is a pneumothorax, and that's 1 in 200,000. And it's usually when someone just gets a little sloppy and didn't respect the anatomy. So overall, it's an extremely safe procedure.
And so what kind of conditions are best treated with dry needling?
Pretty much any painful neuromusculoskeletal condition. So I use it for a lot of different things. Where I use it probably most often: headaches, TMJ issues, neck and back pain, knee arthritis. It's very effective for that, and plantar fasciitis.
All right, so hopefully that's a little bit of information for you about what it does and who it's benefit for. We're going to do a little demonstration on me just so you can see how it goes.